Adversity has a hidden benefit. It can and does spur innovation. The oncology community has always faced complex challenges and responded with creative solutions. Over the past 10 years, the Association of Community Cancer Centers Innovator Awards have showcased 81 pioneering programs that illustrate how to address and overcome barriers. Each is a shining example of how embracing transformation can produce positive results. Innovation often begins with the recognition of an issue or challenge and a willingness to solicit feedback and chart a path forward.
Most of our cancer patients receive their treatment as outpatients, and yet we didn't have a dedicated pharmacist with special training to work with those patients. We developed some information about what other oncology pharmacists are doing in the outpatient setting and wrote up a proposal for this new innovative role called the Oncology Pharmacy Navigator. And at that point, I went to the medical director, Dr. Johnson, and talked about how we could possibly help patients and move the position forward.
This process has broken barriers on so many fronts, from financial barriers that our patient population experiences to cultural barriers. A lot of our patients are Hispanic. They have trouble with English. Some don't read. Many of our patients are elderly.
Innovation requires collaboration. Every ACCC Innovator Award program represents the cumulative efforts of a multidisciplinary team, along with patients, their caregivers, and often the community.
The first thing that patients will undergo is the simulation. After the simulation, our work begins, and we work very closely with our medical physics staff to come up with a treatment plan that is best suited for each individual patient.
We know that the process of radiation therapy can feel very intimidating at first, but a lot of our patients say it really becomes quite routine.
I think it's really important to eliminate those fears, break some of the myths that's out there around clinical trials that help people make informed decisions. And not just having community events, not just making sure that we're getting information out to the community, but that we're really making an intentional and deliberate effort to partner with our community in an equitable way to address health disparities, to move the needle, and that means education, outreach, screening, treatment, survivorship, and participation in research and clinical trials.
Innovation is not one person, it's not one entity. It's really the whole healthcare team.
Innovation drives change when it is replicable and adaptable. ACCC Innovator Award recipients share the steps to their success on a national platform where they often inspire new ideas.
We have developed and launched a new model of cancer care, which we call CALM, Cancer Life Reimagined.
What we're doing with CALM is taking the very best of what we've learned about how to support patients with cancer and their families and pulling it all into one space.
And we're really just encouraging communication about the cancer, how to talk about our feelings about cancer, and how to cope with cancer.
In the end, innovation is about results. The ACCC Innovator Awards promote growth and change and make a measurable difference in the care of our patients.
It's a widely known fact that the patients that are in the top 5% of spenders spend more than 50% of healthcare dollars. So by focusing on a small segment of the population, you can reap tremendous savings without necessarily restricting access to quality care.
The evidence is clear that patients who get supportive care during their practice, there's better satisfaction with their experience, they have better symptom control, they also have some cost savings. But I think one of the big things that really kind of got all this going was some patients actually live longer when they also went to a supportive care or a palliative care clinic.
The ACCC Innovator Awards were created to shine a spotlight on our members that have moved the needle in improving quality cancer care. These programs exemplify the founding principle of the Association of Community Cancer Centers. Together, we are stronger.